Have you ever wondered how you can take care of your breast and prevent breast cancer? Well, as you know, breast cancer is a great concern that has touched many lives. All right, this thief called breast cancer has stolen our loved ones, and to many homes and hopes, it has shattered. It should not surprise you that breast cancer is the most common type of cancer in women, and 1 in 8 women will develop this cancer in their lifetime. This video might be long, but please watch till the end because you are about to save a life. The World Health Organization reported that about 670,000 women died of breast cancer in the year 2022. The numbers are crazy and scary, but this is not to scare you. I make this call because I know you have a big role to play in curbing the prevalence of breast cancer. Let's take a look at some of the risk factors of breast cancer. And if you are wondering what a risk factor is, a risk factor is any attribute, characteristic, or exposure of an individual that increases the likelihood of developing a disease or an injury. Like those things that make one vulnerable to developing breast cancer are risk factors of breast cancer. Being a woman is a risk factor of developing breast cancer, unlike in men, where the prevalence is even less than 1% and very rare. Age is also a risk factor because as one ages, the chances of developing breast cancer increases. Having a family history of breast cancer can make one more vulnerable to developing breast cancer in the future. Okay, although we'll be discussing this properly later in this video. Some other risk factors you should be wary of are exposure to radiation like X-ray, obesity, and alcohol consumption. Okay, so be wary of all these because they are risk factors that can increase your chance of developing breast cancer. Since you are waited to this very point, now let's take a look at how you can take care of your breast and avoid breast cancer. But before that, make sure you are subscribed to our YouTube channel and you are following us on all our social media platforms. The very first approach you can take to take care of your breast is to know your bra size. A fitting bra would give your breast the right support they need to prevent the tissues from overstretching. Unfortunately, over 60% of women are wearing the wrong bra size. It is recommended you get measured for your bras at least once a year because, as you know, people gain weight and lose weight for various reasons. Also, anytime you want to go for sports, make sure you are using the right sports bra. Okay, this will aid you a lot. Another way you can take care of your breast and reduce the risk of developing breast cancer is by managing your weight. Different researches have shown that obesity and overweight can lead to increased risk of developing breast cancer. So managing your weight by being physically active and embarking on moderate exercises for like 150 minutes every week would help in weight management. Okay. Avoiding high soda intake and high fatty food, it would help also in moderating your weight. As I have always told you, taking alcohol is no flex and should never be a flex. Okay, because alcohol consumption would make you vulnerable to developing breast cancer. Another way you can take care of your breast is through stress management. So, for the sake of your breast and overall well being, please take a good sleep, take leave, have a good time with your family and friends. And you can equally start practicing yoga, which would aid you in managing stress. Now, pay close attention to this I'm about to tell you. Okay, years back, we encouraged self breast examination, but unfortunately, the results had not been as expected. So instead, it incited fear, all right, and led many to, be doing unnecessary laboratory tests that they don't even need, okay, which brought about this current recommendation, which is breast self awareness. What this implies is this: you know your normal breast feels, look, in order to identify changes. In a nutshell, be familiar with your normal breast, especially after your period. So you be, observant of any changes so you can easily discuss with your doctor. To prevent breast cancer is advised to avoid the long use of some drugs like hormone therapy. It is important to know that your family medical history has a lot to say about you. That is why you should, be cautious when either your mom, your grandmom, or anyone in your lineage is diagnosed of breast cancer. Make it a point of duty to screen with mammogram every year, most especially if you are above the age of 40. Here are likely signs of breast cancer you should watch out for. One, unusual appearance of vein on your breast. Okay, check out for discharge from your nipple, either clear or bloody discharge. Okay, you might equally notice this when your bra starts to, get stained. All right, having scary sores around the nipple. Okay, you can equally notice changes in size, shape, and even general look. When your breast starts looking like the back of an orange, okay, those noticeable dots, okay, of an orange look, okay, you should be wary of that, and you should do well to, see your doctor. Having constant pain in your breast and armpits or hard lumps, okay, could, be signs of breast cancer. Kindly note that having any or both of these signs that I mentioned does not mean you have breast cancer. It just opens a room for further investigation or screening. So you don't have to be afraid. In all, early detection is key. So if you notice any changes, do well to see your doctor. Breast lives matter. So take care of your breast and stop breast cancer. If you got value, do well to share with your loved ones. And as usual, see you in the next one.